Hi, I'm Matt Mackey. I'm a fourth year student here at Dartmouth, and I'm here to talk to you about how to rock your oral presentations while you're on the wards or in the clinic on your clerkships. So first tip is just to know your audience. If you're in the hospital and you're talking to an internist and you have, basically all day to talk about a patient, take your time, really do a thorough oral presentation, cover all the details, get the pertinent past medical history, etc. If you're talking to a surgeon on rounds and you have a case in half an hour, maybe trim it a little bit more, try and get the 30-second blurb. Family medicine, kind of in the middle where you have a little bit of time to get the info before you see patients, but they also have that schedule moving forward. So just think about the time frame that you want to deliver your cases on. Also think about just the specialty of who you're talking to. So, a surgeon doesn't really care about patients' past medical history that has nothing to do with this current surgery. A family doc cares a lot more about like hypertension, diabetes. An internist would care a lot more about those things as well. So just try and tailor that piece that you deliver as well. If you're calling a consultant for a case, calling a cardiologist, they don't want to hear about their, GU issues. They just care about the heart. So think about that as well. Secondly, it's really important to nail your one-liner. You either get them or you lose them in the one-liner. A lot of attendings have actually, straight up I've heard them admit, I spaced out after the first sentence, and then they just kind of tune back in for the assessment and plan. So that's really where you get to make an impact and show that you've done a thorough history. So just as an example for a contrast, this is a patient who's a 56-year-old male who's coming in with back pain versus this is a 56-year-old male who's got a history of hypertension, diabetes type 2, with a history of 2 prior kidney stones, who's here with a 6-hour history of excruciating, colicky, right-sided pain on his lower back. That paints a much different picture and gives people sort of an idea of where you're going with your story. So that's sort of the nuance you want to try and master with the one-liner. That's good for note writing as well. Thirdly, actually, not lastly, don't forget your assessment and plan. So many times I've just gone in, gotten the history, come out and be like, okay, do I have the story straight? And then I come forward and I say, oh, this is their story. And then the doc goes, well, what do you want to do? And I just go, oh, that's right. I need to think about, actually what I'm going to do for this patient to help them. What do I think they have? What am I going to do? So, with that guy, you want to think, okay, well, I think he's got a kidney stone. Maybe we should check his urine and maybe we should do a CT. And, just have one or two things. It doesn't have to be a thorough, full differential. I don't think most docs expect you to have that, but just a straight up, I think it's this, maybe it's this, I think we should do this test. Just one little leading piece, and then they'll go off and give you their take. And hopefully if you've given them that much, they can do some teaching about what you're thinking. So that's a really good opportunity for you to connect with your attending and to get some teaching. So really make sure you mention at least a little bit what your assessment is. And lastly, just be confident. Confidence is so important. If you're standing up there and you're going, this is 56-year-old, you're going to get cut off, you're not going to get the chance. Take the time to practice if you can find it. Again, on the slower clerkships, medicine, for instance, if you need an extra minute, just ask for it. Say, hey, I'm not ready to talk yet, can you just give me a minute? Most people are very happy to do that. If you need just a few seconds even, just say, okay, just give me a second to gather my thoughts, and try and get that one-liner at least. And you can go from there. So I hope those quick tips are enough to help you rock your clerkships.